Dr. Steve at Active Life Chiropractic, and this is MaryAnn, our physical therapist. Just wanted to give you an idea today about one of our favorite techniques. I'm going to talk today about instrument-assisted soft tissue manipulation. One of the most common forms of that is called Graston. I know MaryAnn really likes the technique as well as I do. MaryAnn, what do you like about the instrument-assisted soft tissue?
I like using the IASTM, or the Instrument-Assisted Soft Tissue Mobilization, because it can really help me efficiently locate tender parts of the body, and it can give a smooth feeling with soft tissue dysfunction.
So what type of conditions do you like to use it on?
Usually patients that comes to me that are like using the Graston technique is patients with ankle sprain, tendinopathies, tendinitis. Usually when they go through the surgical condition, so they have the scarring, so I can use that with chronic scar tissues also.
Oh, okay, excellent. So just to put it in a little more lay people's terms or layperson terms, works great for elbows, works great for ankles, works great for anywhere where you have scar tissue, even overuse injuries where you get scar tissue.
Exactly.
Yeah, very, very commonly. Is there anything else you do with that? Any other techniques or anything else you combine with it?
Of course, in any other treatment, since this is a manual therapy technique, I usually combine it with exercises. I usually like to combine it also with laser therapy. So laser therapy is very efficient when it comes to reducing pain in patients, and as a warm-up also before doing the exercises.
Excellent, excellent. So yeah, I think MaryAnn tends to use a lot of exercise with it, which is great. That's why we love having a good physical therapist here. I tend to combine it with laser and with manipulation. So you kind of get two different uses of it with different patients. Let's take a look at a couple of the instruments and maybe give a quick demonstration of what it is.
Okay.
So the different instruments are all designed with a certain type of material to where when we run it across the tissue, there's actually kind of a vibration, and that allows you to feel the different textures in the tissue.
Yes, especially the tenderness is the painful part of the body.
Okay, and so the tenderness would be the scar tissue and things you're trying to clear out?
Yes, that's true.
Okay, let's do a really quick demonstration. I'm gonna have MaryAnn work on a little bit of tendonitis I've had in my elbow.
Okay,
here for just
so
a
since
second.
we're just going to use it in the elbow, we can use the smaller blade or the edge tool, because this one is like the rod. We can use it for bigger muscles. Okay.
Now, does this usually cause bruising or redness afterwards?
It can cause redness, but not necessarily has to be bruise.
Okay, so there's a difference on how it can be used. Some of the earlier techniques used to go really deep and aggressively and actually cause a lot of bruising. We tend to go a little bit lighter and find that we get really good results without being so aggressive with it.
Okay. So we're just gonna do light movement first.
So right now you're kind of scanning the muscle.
Yeah, I'm scanning it, trying to locate which is the tender part or the painful part of your elbow. So do you feel pain here?
Mm-hmm.
Okay. So,
And you can feel the different film of blade in that area.
Yes, I can really feel it.
So then you're going to work it to kind of break up the scar tissue and clear it out?
So with this, what's nice with this blade, I can use different edges. Like for example, for this one, I can use it to contour with the edge of the bone or muscles.
So the different edges work differently for different parts of the body?
Yes, that's true.
Excellent. So we'll keep it kind of brief here, just so we don't bore everybody who's watching this.
Yeah.
But normally the treatment takes, what, about 4 to 5 minutes?
4 to 5 minutes, yes. Just enough to, if you can already see the redness, you should stop on that part already.
Okay, excellent. Thanks everybody. I hope they gave you a little bit of insight into instrument-assisted soft tissue technique, also commonly known to many as Graston. Thanks.
Thank you.